and from there, it causes, it enters the blood and then disseminate. Now, when it enters the blood, it reaches the bone marrow. It infects, cells of the hematopoietic cells. It can reach the intestine, infect the crits, and causes imbalance in electrolyte because of the lack of formation of intestinal columnar epithelial cells. So what is happening in the brain? I have a picture here which is not there for some reason. Let me see. Okay, there should be a picture of the brain. This one actually. There should be a picture next to it. I'm not sure. Oh, you have it?
We have it.
Why don't I have it? Anyway, if you look at it, this is a cross section of the cerebellum. So what you see three, if you want, regions. The first region on the right is what's called the molecular layer. And then in the middle, you have cells that are the Purkinje cells. The Purkinje cells, they have dendrite, which they spread them into the molecular layer. But below that middle layer, intermediate layer, you have the granular layer of the cerebellum. And the granular layer of the cerebellum is where the infections occur of these cells. So the virus infects these cells. Once it infects these cells, it prevents formation of Purkinje cell, because Purkinje cells come from the granular layer. So when you have infection of the granular layer, you have atrophy of the cerebellum, because Purkinje cells and other cells cannot form subsequently. Okay, diagnosis, as we said, the clinical sign, the hematological data, postmortem finding are characteristic and sufficient, meaning, you may not need any other test to do. But should you choose to do tests, there is ELISA for antigen, immunofluorescence in tissues, PCR, heme agglutination inhibition. All these tests can be used for confirmation. Now, some people ask me about the canine parvo test being used for feline panleukopenia. There is a problem with this, doing this. 60% is the sensitivity. What this means that 40% of the animals will be diagnosed false negative. It means that the tests show up that they are negative, but in fact they are infected. And if you look at the IDEXX website, IDEXX officially, the formal, if you want formally, it does not recommend this test for panleukopenia. So one has to take into consideration this. You can use this test, but you have to use other tests which have higher sensitivity. For example, the traditional ELISA for antigen can be used, or PCR. Okay, immunity and control. There are inactivated and live modified virus vaccines which are available. Usually cats are vaccinated after 4 weeks old. Hygiene is the main problem in panleukopenia because of some disinfectants do not have effects on the virus. This is a naked virus, so a virus does not have an envelope. Therefore, disinfectant that affects the envelope usually are useless, like ethanol, for example. So you have to use the house bleach And there are different forms of house of bleach. There is the hypochlorite or calcium hypochlorite, form of the bleach, and depends on the surface you're disinfecting. Also, you can use different disinfectants. So some disinfectants are if the floor is porous, then they'll go inside the pores, and the smell stays for a very long time, and that smell can cause actually respiratory diseases, and may induce may induce stress to the animal as a result of this. So these are, I have some recommended list of disinfectants that can be used depending on the type of floor. Hygiene, also isolation. Quarantining the animal is very important for a long period of time, 2 weeks. The infected animal, obviously. So disinfection and quarantine or isolation of the animal are both important. Any questions? Yes?
You said the smell can seep into the pores of the floor and cause psychological distress to the animal?
It can cause respiratory disease in the animal. I mean, because of the bleach is very has a very strong smell. Yeah, house of bleach. Okay, so what do you think this organ is? You're taking pathology now? Okay.
Kidney.
Okay, somebody says kidney. You think this is the brain? Okay. Okay. And what's the other one? Oh, what's happening to that cat? What does she have?
A hole in the tummy.
What's that? Speak up. Don't worry.
Cancer.
Sarcoma? Okay, that's a close. It's a lymphosarcoma or lymphoma. Lymphoma is more common than lymphosarcoma in these cats. This is a kidney, and what you see also is the lymphoma on the surface of that kidney. So this is feline leukemia and sarcoma, or FELV. There are 3 things associated with this disease: cancer, anemia, and immunosuppression. So that tells you that the virus can affect cells, hematopoietic cells. It can affect lymphocytes, can affect, can cause anemia, and can cause different type of cancer. We're going to see what type of cancer they are. Now, when it comes to retroviruses, it's a large family of viruses. What we are interested in is the lentivirus, which has the FIV and HIV. It has also bovine virus leukemia and other diseases, caprine arthritis, encephalitis, and so on. But also, we're interested in the gamma retroviruses, which includes the feline leukemia virus and feline sarcoma virus. Okay, now we explain about this. This is for your general information, how retroviruses infect the cells and how they replicate within the cells and or integrate in the genome of the host. So this is for your own information. Now, when it comes to the prevalence of the disease, it's not that prevalent. It's like FIV. It's about 1 to 2%, in the U.S. Now, this is much more serious disease than FIV. And the reason for this because of the development of cancer and because of the various other pathologies that this disease can cause. This is an incurable disease, meaning that once the animal develops the later stages of infection, it will become very difficult to cure the animal. In contrast, in the case of FIV, the FIV infections or FIV virus infection is much milder to the animal compared to FELV. In fact, they've done a survey comparing 1,000 cats in the US which are infected with FIV to another 1,000 which are normal cats. They do not have that free of FIV. And they show no significant difference between the two in relation to lifespan. So what this means is that if an FIV infected cat is taken care or is looked after with supportive therapy and so on, it can live for as much as a normal cat. In the case of FELV, when it becomes at a critical stage, then that's incurable, and the cat may die within 1 or 2 years. Okay, now we said it's not that prevalent 1 to 2%, but it's high, about 30% in cat presented with certain illnesses or at high risk of infection. So again, stress and other diseases that are probably present in the animal or other symptoms can exacerbate this disease. The common risk factors: free access to outdoor, the age, the male gender because of the fighting, and the virus is, like FIV is transmitted by bite wounds. Now, what's different from FIV is that the transmission through the placenta is not that common in FIV compared to FELV. So there is a transplacental or nursing transmission of FELV. In the case of FIV, this is uncommon. And obviously, kittens are more susceptible to infections compared to older animals. Now we describe a number of, we describe one type of cancer, which is the lymphosarcoma. Lymphosarcoma is the most common, if you want, cancer that you find associated with feline leukemia and sarcoma. The second cancer is the myeloproliferative disease cancer, and in this case, what you have high proliferation of cells, larger proliferation of cells, and myelo. What does myelo indicate? Bone marrow, exactly. So you have bone marrow, if you want, cancer in this case, and fibrosarcoma, which is the cancer of fibroblasts, connective tissue. So anemia will be as a result of affecting again the bone marrow. So production of, if you want, red blood cells is impaired as a result of that. And the immunodeficiency, because that virus targets lymphocytes like the FIV, and as a result of this, it impairs with their function, and actually there is depletion of these cells, and as a result of obviously depletion of important immune cells such as lymphocytes, what you're going to have is bacterial infection. we know that it is like HIV, it's a retrovirus, it integrates in the DNA. So what this means is that at some stages, the animal may not show the presence of the virus. And in fact, in the case of FELV, if there is no provirus in the tissue of the animal, and even if it is present in the blood, in blood cells, that's indicative the animal is not shedding the virus. So shedding usually is associated with presence of the virus in form of provirus in the tissue of the animal. Now, obviously, because of the integration also, you have phases when the P27 protein is found in the blood circulation. And in fact, what happens is that it takes about 1 to 2 months before you see any protein coming from the virus, the P27 in blood circulation. What this means, if it is a recent infection, the animal will test negative. So this is why it's always recommended to follow up after 3 months, 2 to 3 months, by another test to confirm whether this animal is infected or not. So there are stages when the P27 protein is not present in the blood circulation. The same thing happens with FIV, because with FIV, also within 1 to 3 months, you don't, within the first months, you don't see antibodies, okay? So it takes, 4 to 6 months to, that the antibody concentration in blood circulation is enough to be detected by, the normal test. So if animal is negative because of a recent infection, that does not mean that the animal is not infected. So again, a follow-up after a few months is important to confirm whether this animal has the disease or not. Yes?
So you said for FELV, P27 isn't found for 1 to 2 months.
Right.
So you need to recheck in 2 to 3 months, and for FIV, the period is
Yeah,
4 to
because
6 months.
you know how long it takes to produce antibodies, okay? We said, we mentioned in the lab, how long does it take to produce antibodies?
21 days?
4 to 6 or 3 to 6 weeks, depends. But it's during that period of time. So within 1 month, if it is an acute, if it is an early infection, you may not find the antibodies until after a month or so. Okay. Now we described the lymphomas that are present on the kidney. So these are neoplastic lymphocytes. In relation to the feline myeloproliferative disease and anemia, there are 4 types that are recognized. There is the erythemic myeloses. Again, what does erythemic means? It refers to red blood cells, okay? So it targets erythroid progenitor cells, which subsequently give the red blood cells. Granulocytic leukemia, it targets cells which have granules. And which cells have granules? Neutrophils, basophils, etc. Erythroleukemia, it targets both leukocytes and red blood cells, progenitors. And finally, myelofibrosis, which target fibroblasts. So those are, if you want, the cells that are targeted, and those that are responsible for what we say the anemia, immunosuppression, and cancer. Now, one thing which is important, and it comes, has relevance also in diagnostic tests, is that once the antigen being the P27 a protein being present in the circulation, or the virus is present in the circulation, immune complexes can form. What this means is that initially when the virus infects, there is a production of antibodies. And when the protein from the virus is released, then the antibody and the P27 form immune complexes. Now we heard about, probably in physiology, about immune complexes. What happens when you have immune complexes? When you have immune complexes, and large number that precipitate in the kidney. This is one organ which is targeted by immune complexes. Basically, the glomeruli are targeted, and as a result of this, you have inflammation, in the kidney, which is called glomerulonephritis. So, glomerulonephritis is associated with FeLV as being, one feature as a result of formation of immune complexes. How this is relevant in terms of diagnostic tests? If you have complex virus with antibodies or complex antigen with antibodies, and you're looking for antigen, you may not find the antigen being there. So your test may not detect the antigen being there, because the sites where the antibody in your test bind to are hidden by antibodies in the patient's blood. So that's again why you should always confirm this test. One event or one occasion is not enough, and one test is not enough. Now, commonly, gingivitis, stomatitis are associated with also, feline leukemia.